Hello everyone to what your midlife labs and diets don't tell you about how to increase your energy, balance your moods, and feel amazing in your body. Because let's be honest, midlife, you hit 40 and things change in our bodies, right? So, welcome. For those of you chiming in, feel free to come in. I invite you to come on camera. We always find that it's most interactive and most valuable. We can give the best support and the best engagement energy to each and every one of you if you are on camera, interacting with us, giving us feedback. So, for those of you that I have not yet met, my name is Amanda Hinman. I am the founder, lead practitioner of Hinman Holistic Health, also a best-selling author of the Thyroid Hormone Solution, where I help women in my Thyroid Hormone Solution program to understand what's going on with their hormones, mood, and gut so that they can 3 times their energy and feel fantastic in their bodies. Who would like, Megan, would you like to introduce yourself?
Yes. Hello, everyone. My name is Megan Ross. I am a physician assistant and health consultant, really focused on kind of joint pain, longevity, and just managing a lot of those chronic pain conditions through a lifestyle medicine approach. I've worked primarily in orthopedic surgery and pain management, just in that clinical setting for years, and just realized there's a real discrepancy with, being able to hit all of the root causes and the confounding factors that play into, why we're experiencing these symptoms, especially in midlife. And so really kind of shifting to a nice whole person approach has been really wonderful for me and for clients, just to see how much exponentially they can relieve their pain, improve their quality of life without relying on, the medications, surgeries, etc. So I'm excited to be here.
Thanks, Megan. And Nicole, why don't you tell us a little bit about who you are?
Hi. Hi, everybody. My name is Nicole Sayed. I'm a family medicine physician turned functional medicine health coach. I actually practiced in traditional medicine for about 10 years in various primary care settings, both private, federal qualified, and over a few years just realized that that system, it just is not as conducive to healing the body as I felt like I could get with patients and clients over a few months working with them. So that is why I've left primary care, focusing on healing bodies and minds and metabolism.
Yes, we
Yeah.
are here. We are so excited to bring together some new insight and inspiration and clarity. And I'd love to ask, like, I know we said, hi, Deanna, so great to see you. Hi, Robin. Hi, Christina and Felicia. I'd love to ask everyone to come on camera if you're able to join us. Like I said, that gives us just so much more engagement, and it feels like we're kind of here in the room together having a really powerful discussion. And I always think it's most valuable. You get the most out of, like, this is important. This is your time, right? This is your energy. You get the most value if you have a clear intention. So my first invitation for you today, everyone who's tuned in, anyone who's going to be watching the replay as you're doing this, maybe grab pen and paper so that you can take some time, and we'll just give it about 60 seconds, 1 minute, to get really clear of what's one thing that will help you to actually move the needle in your health. What is maybe one question you want to have answered, maybe one new inspiration that will help really dial in your behaviors and your decisions after this, or a sticking point, something that's kind of held you back. Just sit with what would make your time today in showing up here, carving out the space to be on the panel worthwhile. And I'll be quiet and give you a few minutes, a minute there or so to put pen to paper and really think about it so we can have a clear intention coming in. And if you're open to it, there's a chat feature here. You can pop into the chat where you're joining us from and what is your intention? What is the one thing that you want to take away from this session today? It could be like, you can put an I for inspiration. You can put a Q for my biggest question answered. You can put, anything to give us cues. We are here to serve you. We are here to make this as valuable as possible for each and every one of you. So giving us the insight of like what will provide the greatest value for you. It's going to be really useful. So please drop in the chat here as you think about it. And I know sometimes it's a little quiet, right? We gotta get the juices flowing, get going. And while we're doing that, I'm going to actually drop into the chat too. You may have seen this in the email, but just in case, I'm going to put our link to consistency. Thanks, Deanna. Yeah, I can relate to that. Like, it's hard to take the choice that could be the healthier choice consistently, especially when life is full and life feels like a lot of different angles pulling on you, right? Kids, parents, all different things. Felicia says, "Oh my God, yes, I am all or." Oh, okay. So there's something that's really insightful about knowing if you're all or nothing. Felicia, thank you. I can first totally relate to you, and I'm sure you're not the only person who's felt that way. And so we're going to be talking about what I call why bother syndrome. In fact, I'll kind of preface this conversation with this. I've kind of come up with my own syndrome, right? And why bother syndrome. I'll kind of give this, let me know if any of this relates to you, if you can resonate with any of these pieces, because this happens many of my clients. I'm just talking with a client, Corey, that I'm working with right now. And when she came to me, she had been frustrated for probably about a year and a half to 2 years with her own health. She's like, I am getting pretty much guaranteed 2 to 3 nights out of every week. I wake up feeling exhausted and depleted. I don't feel like I got a full night's sleep. She had put on about an extra 15 pounds, and she's like, I've tried to do intermittent fasting. I've tried to do some of the Jenny Craig like meals and plans that I had done previously that used to work for me, and now they're not working anymore. She had tried to even go to her doctor and see recommendations for GLP-1 medication. So she literally has tried to do various things. She said to me, she's like, I thought about getting additional testing to like look deeper at my hormones, to look deeper at some of the functional pieces and get clarity of what's going on instead of just being told my labs are fine. But life has always gotten busy. Like, I've always had, something come up with my kids or something come up with work. She's an attorney. She's very busy. So she's like, it kind of just got put to the back burner. It falls into why bother syndrome. Then at the start of this year, February, she joined Club Pilates thinking like, okay, I'm going to get a new workout routine. I'm going to get my body moving. And that lasted for about 5 weeks. And then again, fell off, didn't consistently get into a rhythm and make it part of her practice. So can anyone relate to this where you've tried things, you're aware of some frustrating symptoms that have been like kind of bothering you or hanging out for a while, but yet you haven't been able to find a solution that's sustainable and that continues to work for you to create lasting, like decades long results? Then can anyone relate to this? You kind of get fall into what I call it, why bother? Because it's kind of like, I've tried this before. I've invested in a Club Pilates membership. I've tried the Jenny Craig. I've tried the intermittent fasting. I've even gone to my doctor and had conversations and had my lab work run. And I'm not really getting anywhere. So it's kind of like throw my arms like, why am I even bothering? Can anyone relate to that? Or is it just Corey? Is it just me? Yeah, totally. So put in the chat, and me, if you've felt any of that before. Robin saying, yes. Oh my God, yes. Christina, hormone, yes, I can relate. Christina, yes. Great, so you're not alone. So first of all, if that's you, you're in the right place. And I just want to know, like, I can relate. Absolutely, Felicia says. Absolutely, Deanna. Yeah, so thank you first for being here. Thank you first for being honest. And this is what we are going to help you gain some momentum. Again, it's not your life is not going to be completely transformed in 2 hours, but we are going to do our darndest to provide the greatest value and the greatest inspiration. It's about where can we galvanize our focus, our inspiration, because when we can move forward and take those steps forward, it's going to change the trajectory. Okay, so I'm going back to see what everyone wants. If you're just joining in, thank you, Joanne, for coming. Thank you, Christina. Pop into the chat. What is your number one intention that you want to create from this panel today? You've carved out the time. You're an important, busy person. So I really value and appreciate your time. And we want to make sure that we deliver for you what will be most helpful. So Christina wants hormone and health. Robin says, remembering to celebrate the small success. Yes, it's so important. In fact, actually, Corey, the same client I just told you about, it was so funny because we had another one of our sessions yesterday. And the week before, she had said, you know what, Amanda, like, I feel like I've been making some intentional changes with my nutrition. I'm really dialed in because I know what my body needs. I've started to take a couple of key supplements that we've talked about based on my micronutrient test. So I know, and I'm doing the things, but I haven't seen the number on the scale change in the last 2 weeks. So she's looking at 2 weeks. So she was getting defeated. We have all felt this, right? Felicia said, I'm all or nothing. It's very easy to then be like, oh, why bother? Like, what's the point of all of this and this intention? But guess what? When we got together yesterday, every couple of months, I do a symptom checklist with my clients, and we sat down and was like, she had listed all of her symptoms, and then we refreshed it again for where she is at now. She had a 69% symptom improvement in 2 months, and she's like, my bloating is gone, my insomnia is gone, my aches and pains in my body went from like a category 18 down to a 3. She's like, holy cow, you know what? I realized that I used to be focused on one metric because I just wasn't paying attention, or I didn't have a way to quantify or a way to really understand other inputs about how my health is progressing. And she's like, you have helped me to see it is such a bigger tapestry of what's valuable and what's priority instead of just the one number on the scale. And she felt like she left and she felt like so motivated, so inspired. She's like, this is massively changing my body. And I go, it is. Not only is it changing your body composition and how you feel and your confidence, it is changing quality of life for decades. This is what we're talking about. So I'm sharing this because, yeah, it's so valuable. Absolutely, absolutely. Oh, and Carolyn's in the waiting room. I apologize. Making her wait. Okay, I'm going to pop in here. I've been chatting too much. I'm going to pop in here one more time. If you haven't yet opened it in the link in the chat, I just put the link for the workbook for today's session. Feel free to follow along. If you want to jot some notes or print it off, you can do whatever you want. That workbook is there for you. And Joanne, thanks for joining us. We are ready. Hi, Carolyn, great to see you. We are ready to kind of get going here with some movement. And here's Tammy. I gotta make sure I keep seeing people in the waiting room. All right, Megan, do you want to kick us off with some of our new learning? Who's ready to go? Who's excited? Anyone else excited besides me? Kimberly's excited. Deanna's excited. Felicia's excited. All right, girls, we got this. Let's rock and roll. Okay, share screen here and what your midlife labs and diets don't tell you about how to feel absolutely fantastic. This is where we're going today. All right. Why don't you kick us off here, Megan?
Oh, yes. Hello, everyone. Everyone who wasn't here in the beginning, welcome, welcome. I love the energy. I think it's going to be a really great conversation today. So I encourage you to share any thoughts, in that chat, utilize it. That's what we're here for. That's the best way to kind of just have conversations with each other, right? Talking at you is not helpful for anyone. So, anytime you have a question, a thought, pop it in the chat. I'd love to converse with you while we're here, right? Take the time to do that. So for those of you who missed it in the beginning, just from the introduction, I'm a physician assistant and health consultant, and I work primarily in orthopedic surgery and pain management. And I just realized over the years and, that clinical lens, how those short 15-minute clinic visits to try and address your problem, do the exam, right? Pinpoint the diagnosis from potentially an arbitrary lab result, get a treatment plan, and then explain it to you, not only in a way that's understandable, but applicable, just impossible, right? There's so much going on. It's hard to even take away what's going on in those visits. And so I realize that a lot of times, patients are leaving visits, or you're maybe leaving visits feeling frustrated. You're told maybe briefly to eat better and exercise, and then given a new medication or even a surgical recommendation, but not a real answer, right? And our health is more than just this reactive Band-Aid fix. So I created this program called the Pain Relief Pathway, and to really prioritize a whole person lifestyle approach when it comes to wellness, longevity, joint pain, and the key to getting sustainable results and quality of life that we're looking for. So long-winded, but today we're going to dive into the silent inflammation behind joint pain, arthritis, and hormone chaos, and how simple shifts in food and daily routine can really reignite your energy during this midlife time without those extreme diets, without those exhausting workouts, in a way that works for you, not against you. So Let's start with one of the biggest, but often overlooked culprits behind those midlife energy struggles, and that's silent inflammation. So when we hear inflammation, a lot of us are probably thinking, oh, bad, yuck, we want to get rid of it, right? Anybody else feel that way? Like, oh, inflammation, buzzword, trigger word, got to get rid of it, right? So inflammation isn't always bad. In fact, short-term inflammation or acute inflammation is actually protective. It's your body's way of healing from an injury, fighting an infection. It's when we have that chronic, low-grade inflammation that's a different story. Now, this is the type of inflammation that tends to build up quietly. It's fueled by factors like stress, poor sleep, nutrient deficiencies, hormone shifts, and over time, it can show up in really uncomfortable ways. Persistent fatigue, stubborn weight gain, particularly around our midsection, joint pain or stiffness, worsening hot flashes, night sweats. Anyone relate to these symptoms? Anyone like, yep, I got these. What am I doing wrong? What do I do about it? Yeah.
Yeah, I invite you to put a Y in the chat if you've had any of these symptoms. Like, yes, like this is me. I've been there, felt this.
Mm,
Just let us know if this is something that's hitting home for people.
yeah.
All of
All of
them. Yeah, totally. I hear you.
Totally. Yes. So all of these things bother us on a regular basis, right? Research shows that chronic inflammation can contribute to insulin resistance, something that Dr. Nicole is going to talk about in a minute here. Cardiovascular risk, so the heart health that we need, and even mood disorders, all of which become even more common during that perimenopause, menopausal transition in midlife. So I want you to think about your own health journey right now. We just talked about it, but have you ever felt like you're doing everything right? Maybe you're eating clean, you're exercising, but your energy still crashes mid-afternoon. Or you notice that despite staying active, your joints might ache more than they used to. Anyone feel that way? Yeah.
Yep.
Yes.
Deanna says food sensitivity that builds up. Yeah, that can
Oh,
absolutely
yes.
contribute to
Yep.
chronic
Yes,
inflammation.
which stems from so many things. Exactly. Yep. Robin. Yep. Good. Yeah. So these are often signs that your body is asking for deeper support. So this brings me to a real life example, somebody who felt the same way that a lot of you are feeling, right? Until we found what was missing. So this is Mandy. Mandy's one of my clients. So she's 45. She's an active mom, a busy professional. She's always prioritized her health, right? She eats what she believes is clean, works out regularly, stays on top of routine checkups. She's doing everything she thinks is supposed to be right, right? Yet she came to me exhausted, right? Mandy was battling constant brain fog, energy dips, headaches, even early signs of prediabetes and high blood pressure. And her labs kept climbing despite her best efforts. Anyone sounding familiar here to this, right? Maybe you've been where Mandy was, feeling like, your body's changing faster than you can keep up, even when you're doing your best. Anybody? Just raise a hand. Yeah. Yes, exactly. So what helped Mandy and so many women I work with find their energy again? It starts with building a strong foundation. Now, when we talk about thriving throughout midlife, especially during perimenopause, menopause, into our old age, we have to look at the whole picture, right? It's not just about singularly eating better, right? Or moving more. It's about building this strong foundation for your body to feel supported, to feel energized, to feel resilient. All right. There are three key pillars that I focus on when it comes to kind of achieving this. And they may feel basic and nuanced. And that's for a reason, right? Because these are the fundamental cornerstones of our health. And if we neglect these seemingly arbitrary things, all the other work you do is going to be for nothing, right? So getting down to the foundations, the three pillars that I like to focus on are nutrition, strength training, and recovery. Let's break them down. Now, when it comes to nutrition, when it comes to diet, I like to focus on a balance, right? And what we can add to our meals rather than what we have to cut out. Does anybody feel like when they're looking at all the different TikTok trends or online trends or X, Y, and Z, you have to cut this, you have to eat only this, you need to follow this routine. Anybody feel like there's just so much clutter out there and you're like, what do I do? How do I eat? Yeah, confusing for sure. Right. So just kind of simplifying it is really where I found you get the greatest result from, right? And again, arbitrary, but simplicity is key. I've come up with a little simple formula in a mnemonic just because mnemonics are easy to remember, right? PFFC, right? I call this power fuel for cells because it's exactly that. It stands for protein, fiber, healthy fats, and quality carbohydrates. These are 4 essentials of our diet that work together to give our cells and our bodies the fuel it needs to thrive. Now, let's break each of these down just a little bit further. Now, a lot of us have heard about protein, right? It's crucial to incorporate into our diets. It's key for protecting muscle, keeping metabolism strong. And women in midlife typically need around 1 to 1.2 grams of protein per kilogram of body weight. And a little more of strength training is part of your routine, which it should be. And we'll talk about why in a minute. And there are a lot of ways to hit these goals, right? With both animal, plant-based protein. The best thing you can do is finding the foods and the ways to incorporate it that make sense for you, that you enjoy. A common theme you'll hear that I mention often, because if we're not doing things that feel good to us or that we enjoy, kind of like Amanda mentioned earlier, we're never going to stick with it. You can get that membership or this, cut out everything, but if you're not enjoying it, you're never going to stick with it long term, right? Now, incorporating many colorful foods, plant-based foods help bring that fiber in, the F of that PFFC, right? Fiber, antioxidants, omega-3 fatty acids. These help fight and calm inflammation, which, as we discussed, big contributor of joint pain, fatigue, weight changes. And now this next one I want to really touch on, healthy fats. Now, so many of us have been taught to fear fat, right? Anybody else feel like they're like, we got to avoid fat. Fat is bad. Fat will clog our arteries. Fat will cause the weight gain. Anybody else feel like they hear that a lot, or maybe that's the common misconception, I'll say. Yes, exactly. Low fat, fat-free marketing. They do a great job. They target those buzzwords, right? But we don't really have a good understanding of what that means if we're actually avoiding fat. Now, fat is actually crucial for our diet, right? Particularly unsaturated fat. So knowing the right kinds. There's saturated and unsaturated fats. This is getting a little into the weeds, but the biggest thing is realizing the quality of the food we're eating. So when it comes to fat, those unsaturated fats, like your olive oils, your nuts, your seeds, your fish, those actually calm inflammation and support hormone balance. And then finally, quality carbohydrates. So carbohydrates provide a steady energy without the crash. Fun fact, 60% of our body's energy comes from carbohydrates in our diet. Did anybody know that? Did anybody know how important those carbohydrates are? Yeah, I see some nods here. So 60% of our body, go ahead.
Can I jump in here? Because I think it's really interesting. There's so many people, I don't know if anyone else can relate to like the whole low carb. And it's like, there's definitely been a lot of focus on low carb or cutting all carbs, which can be detrimental. I don't know if you find this, Megan, but especially for women over 40. Yes, protein is really, really important. But if we try and go too low carb, that could actually really deplete your energy stores.
Exactly. It does. Exactly. And that's, again, the whole concept of balance, right? It's so easy, even going back to, I forget who mentioned, but that all or nothing mentality. If you kind of phrase that into all or nothing on protein, right? But you're neglecting the carbs, you're neglecting the fat, you're neglecting the fiber. You're not going to get the results. You're not going to sustain and nourish your body the way that we need to, right? So it's that balanced approach.
Totally. And I'd love to get feedback from this group just so we can kind of know where you're at. If you look at that, I love, and it's funny, Megan, you do PFFC for carbs. I do PFFV with my clients for vegetables.
Oh, nice. Yeah.
Very similar, but it's easy to remember like that rhyme, right? I'd love to have Christina's, I've always been a carb group with an athlete. Yes, I totally relate to that. Can everyone, I invite you to put into the chat, what's the one area that you're like, oh, you know what? I could probably really dial it up a little bit more here. Is it more protein for you? Is it more fiber? Maybe it's the healthy fats. Maybe it is the high quality carbohydrates. What is, okay, Deanna's saying fiber. Deanna, I know that we talked about that a lot. And what is the one thing that one of those groups that each of us think? Carbs, Robin, carbs. Okay, you've been cutting those. Christina says healthy fat.
Yes.
and fiber, protein I can digest. Okay, yeah, that's good. Carbs for sure. This is good. So again, already the clarity here. It's like we have to personalize this information rather than just hear the blanket generalities. And you
Mhm.
ladies are dialing it in of like what your body needs. So this is good. Awesome.
Like,
Okay,
love-
let's jump back in. I just like to always kind of like
Yeah,
capture it so we soak it in.
perfect. Yeah, got a good starting point from nutrition. Love it.
Oh,
All
so,
right,
so, so.
so dialing in, we've dialed in on nutrition now. The next pillar that I love to talk about is strength training, right? I know we're told to work out, to exercise, but how and why? I think those two questions are key to understand for each of us so that we know how it applies to our own lives. We can make it personal. When we make it personal, then we have a reason for why we're doing it instead of just a fact that we're seeing, online, right? So this is one of the biggest game changers for midlife. Once we hit our mid 30s, our bodies naturally start losing muscle. Does anybody realize 30, not 40, not 50, not 60, 30? So that's, I mean, we're past that, right? We've already moved on to, over 40. So we're already 10 years into that. This is a process called sarcopenia. Long word, but basically just means that muscle loss, right? And the truth is that the less muscle we have, it does suck. But this is the good news here. The less muscle we have, the more our metabolism slows down, our balance weakens, our risk for injury and bone loss climbs. But the good news, Felisa, is that resistance training can actually slow this process or even reverse it. And it doesn't mean you have to go lift heavy hours in the gym, right? I've had a couple clients now who are prioritizing strength training, whether that's with resistance bands, light weights, body weight even, done just twice a week. And they've increased their bone density scores to where they're no longer in that osteopenia, osteoporosis category, and they're back to normal. And that's truly just from incorporating that muscle strengthening into your routine and learning how to do that, ways that fit, exercise routines that are comfortable for you. That's how you're going to stick with it. Again, convenience is everything, convenience and consistency. So we're talking stronger muscles, better bone density, improved balance, weight management, not fighting against it, not, or working with your body. So think of it as training your body to stay strong, active, and capable, not just for now, but for years ahead, right? What we're doing now is what we're going to be able to do down the line, whether that's playing with the grandkids, whether that's moving around your house and being independent, whether that's still doing those activities you love. It's a long game, right? It's not the short game, it's the long game. And what we do now will help kind of tee us up so that we can be successful down the line. All right, and then the last pillar here, recovery. Now, who knows recovery? Has anybody kind of focused on recovery? Does anybody feel like they neglect recovery? Or maybe they don't know what recovery is? Pop in the chat. Like me, I struggle with this. Oh, I didn't even know this was a thing. Anyone else feel like they struggle with recovery? Yeah, Caroline, yeah. So this is the piece that so many of us tend to overlook, right? We think of exercise, nutrition, yes, Christina, yes, as the main drivers of our health. But the truth is that our bodies only get stronger, leaner, more balanced when we give them time to rest, repair, reset, right? So things like sleep, hydration, stress management, these aren't just nice to haves. They're absolutely essential. Okay. And why is this? They aid in cellular repair. They boost our immunity and they directly affect cortisol. Cortisol is our body's primary stress hormone. How many of us know cortisol? How many of us are like, oh yes, high cortisol, not good, gotta drop the cortisol? Yes, right. And we think about nutrition, we think about exercise when it comes to managing that, but a lot of us overlook that recovery aspect and how it relates to that cortisol level, the sleep quality, the stress management, even the hydration. How are we drinking enough water, right? When cortisol stays high for too long, that's where it can trigger fatigue, stubborn weight gain, frequent hot flashes, night sweats, all of those uncomfortable symptoms that we talked about earlier with that silent inflammation, because the cortisol does cause some silent inflammation. But small intentional shifts really make a huge impact. So things like creating a simple bedtime routine to support deeper sleep, right? Staying consistently hydrated throughout the day, carving out just a few minutes for some breath work, breathing exercises, mindfulness. How many of us struggle with this area? Anybody else? I know for me personally, sleep and like stress management are two of the toughest ones for me. When I lay down at night, my brain's still going a million miles a minute. It takes so long for me to really develop those routines, right? Currently taking some supplements for stress management. Nice. Yeah. And then same with breath work. Our days are so busy. Who wants to just sit and breathe for 5 minutes, right? We don't have time for that. It's about kind of carving out and being intentional of incorporating those into our routines to where we can make it a habit. And then we see those really impactful results. So
I
think of
love what you're
recovery.
bringing up here because I feel like, honestly, sometimes we hear these things, but the actual prioritization of putting it on the calendar, like I'd love to have everyone chime in here and say, like, what is one way that maybe you thought like, ooh, it could be more valuable for me to add in a meditation each day. Or I know like Robin is really good with doing tapping EFT to release emotions daily. Is there anything that you can think of right now that maybe signaling of like that could be a good recovery system for you? Christina says, I, take supplements and that can help with kind of recovering the nutrient replenishment. Let's see, Felicia says, set the mindfulness breathing thing on my watch and sometimes I snooze it. Yeah, but sometimes I do. Well, it's like, oh, we can even have the reminder and we forget it. But like, I'd love to hear, what are people thinking of, like, if I stretch myself, if I'm going to actually have this time that I'm here today make a difference in my life, what would you change, or what's one thing that you would do differently in a way to support your recovery? Please
Felicia,
share.
I love that one too, because I had a client who was struggling with kind of mindfulness meditation as well, and we stacked it with her alarm. So every night she sets her alarm, right, for the morning, and she labeled her alarm, take 5 deep breaths. And something as simple as that, where every day she's going to check it. It's just a mental reminder. And you might not do it every time, but as long as you're getting that reminder, it starts, you incorporate it once and then twice. And then all of a sudden, every time you're setting your alarm, you're doing the 5 deep breaths. It's just a way to seamlessly incorporate that into your routine.
I love that. You're talking about I call that habit stacking.
Habit
Like, do a habit
stacking.
stack with something that
Yes.
you're going to do automatically anyway.
Right.
One of my habit stacks is going to sound so cheesy, but I talk about the importance, like you said too, of resistance training or just movement throughout the day. I drink a lot of water, so I've got to pee at least 5 times while I'm at my work, office during the day. So every time I walk to the bathroom and walk back in through the doorway, like the door frame is like a cue of, like, door frame means do 10 body weight squats.
Yes.
So it's like something like that, where you can like habit stack, or like you said, like set that timer.
When I make a cup of coffee, yep, I do that cue a lot. We'll do 10 body weight squats while the coffee's brewing. You got to wait for it anyway, right? Let's maximize
Yeah,
time. Do your
I
squat,
love it.
right?
These are great. They're great. And Deanna says, I went to bed earlier this last week with school, and it's definitely making a difference. Felicia
Yes.
says, great idea. See, this is why it's good to be in the discussion, because it's like sometimes we just need that little, like, or like, I could do that when I'm making my coffee.
Yeah.
Like, add that in, and these all make a difference.
Yes.
That's the thing, is like, we get to recognize it's the little things done repeatedly that truly change the game.
Exactly.
Yeah. Awesome. You're so inspiring, Megan. Thanks for sharing all this. This is great.
Sure. I love this dialogue here. Yeah. So just, we know that, kind of like you mentioned, Amanda, recovery, we know it's important, right? Another one of those things, we know it's important. Now we know why. Now we work on putting it into practice. All right. So think of it as the bridge between all your healthy habits and the results you want. So without the progress from your workouts and nutrition, they just don't stick the same way. And let that be the encouragement for you to prioritize them. And then you'll see, exponentially how they're helpful for you down the line. So moving on to the next slide. Yep, let's see how putting these pillars into practice transform Mandy's health. So before, Mandy relied on calorie, carb, fat restriction. She focused mostly on cardio, right? This left her tired, stressed, nutrient depleted. And through digging into her eating habits, we realized she was actually under-eating for what her body required to function optimally. A lot of us think that weight loss means we need to cut calories, and at times it does, right? But it's not a one-size-fits-all approach. And so that's why it's so important to find what fits for you and your body and what you need, from a personal approach, to find out how exactly to create a strategy for it. So for Mandy, we shifted, Balancing meals with adequate protein, fiber, colorful produce. We cut back on some of those high intensity workouts or, training excessively at high intensity and added more strength in. We really, really focused on her sleep habits, her recovery, letting herself take a couple of days off sometimes. It doesn't have to be go, go, go. We're a very productivity driven culture, right? But it's okay to take a step back and to just kind of be for a day or even two, right? Within a few months, Mandy was like, my energy is better. I'm not crashing anymore at 3 p.m. I don't have the headaches anymore. She went to her doctor for a checkup and her A1C, that blood sugar level, was down 2 points, which moved her out of that prediabetes risk range. And she did lose some weight, but she did it without restriction. She did it without burnout. And I think doing it in that, appropriate, sustainable way is how we make sure those results stay long term. So I invite you or I ask you, what would change in your life if you had more energy, strength every single day? What's a couple things? Pop into the chat. If you had more energy, if you had the strength, what's one thing? I know we talked about at the beginning, your hormones would be better, maybe. Maybe it is you lose some weight. Maybe it is you just had more energy during the day. Spend more time. What would you kind of say would change in your life if you had more energy, if you were able to figure that out? Drop that in the chat for me. What do you think? More patient with my kids. Yes. You know what? Our mood is directly impacted by this, right? And we only have so much patience. And it's important to prioritize yourself too. Yep. Drop 10 pounds. Longer, consistent sleep. Good. Yep. Love it. So many things. Balanced mood. Huge, huge. We realize how important our overall health and kind of balancing all of it will help give us that weight loss, will help give us the sleep, will help give us the mood regulation, which just makes us happier and more, willing to do these things too, willing to make those adjustments. So let's wrap up with a few simple steps to start implementing. Let's not overcomplicate it, right? Start small, weave those new habits, that habit stacking we talked about, into your routine so they feel natural and something you enjoy so you can actually stick with them, right? And give yourself grace for the days or maybe weeks where it doesn't go perfectly. Success and progress is a very, swooping scale, right? It's not this direct incline. You're going to have some bad days, some weeks. That's just life, right? And not letting those set you back long term is really how we keep moving that needle forward. So starting simple, balancing your meals, use that PFFC, or when Amanda talks PFFV mnemonic, however you can remember it to trigger and jog your memory. Move with purpose, prioritize the strength workouts, but in a way that works for you, that you enjoy, right? And really, really protect your sleep and hydration like your energy depends on it, because it really does. You don't need an overhaul. You just need the right things in the right order with the right strategy and to stay consistent with it. So I'd love for you to just write down on your workbooks, or just keep in mind that one thing that you mentioned that's doable for you to start this week. And I want you to hold yourself to it, to exploring it more. All right. And we'll see kind of where we can go from there.
Yeah, share with us which one feels like it's going to be the most accessible, doable for you to be like, okay, well, today's Thursday. So we have from Thursday to next Wednesday is technically a week. So if you were to pick one area, one thing that you could, and again, science, the neuroscience shows that when we have an intention, that's why we set an intention for today, that's the first step of progress. But when you have an intention for a plan, when you write down that plan, and then when you speak it out loud to somebody else, your chance of reaching that happen and making that actually happen go up over 72%. So if we just thought of it, I invite you to write it down. Megan just said, what's your thing? And then share it with us. Okay, so let's see what people are coming up with.
We need a water challenge here. Everyone drinking their water. Yeah.
Daily emotional freedom technique. Yes. Hydration. Hydrate. Okay, so hydration is huge for that recovery piece and sleep. Way to go, ladies.
We have a better sleep checklist in one of the resource books. Use the better sleep checklist and try and start with that, nighttime routine. Try and develop one thing, right, to start, and then add another until you find a routine that gets you that quality sleep. Because we're right. It really does affect our mood. It affects how we're eating, how we're moving, our energy levels. All of those things start with sleep. right?
And you know what? You want to know my little hack for sleep?
Always.
This is what because sleep is, and there's a lot of factors that influence. Obviously, having a winding down routine is really critical, and having adequate exposure to light. So what
Mhm.
that means is our eyes literally take in the full spectrum of sunlight or darkness, and it signals to the pineal gland about the release of melatonin to prepare us to sleep and all of this stuff. But oftentimes we in the Western world have very, very minimal exposure to natural full spectrum sunlight outside because we work indoors. We're indoors under fluorescent and blue lights and screens all day long. And we have very high exposure to blue light, which is the shortest wavelength and the most stimulating to the brain, especially after dark, because we're watching our screens, we're looking at the social media, we're scrolling, or we're doing something on the TV. That is telling the brain to like, be alert, be alert. So the hack is to try and get outside for about 5 minutes early in the morning so that you kind of signal, hey, it's time to wake up. And then at night, can you give yourself an hour off the screen before bed, right? That really signals that light and dark cue to your brain to help your brain actually have, use its patterns to start to wind down. Things to think about. Okay, so just want to add that. Robin says add a 15 to 20-minute workout to my stretching schedule. I love that, Robin. Your strength training.
That's the
Yes,
habit
building some
stack. That's a
resistance.
great habit stack. Mm-hmm.
Good, good, good. All right, well, we've got some takeaways already, and we're just getting started. Wait till you, oh, and I do want to share. Let me go back here and share in case I forgot to show this. You have your Wellness Jumpstart as
Yes.
a free gift for people.
Yes. Yeah. Just real quick. So it's a combination, my anti-inflammatory food cheat sheet, my better sleep checklist, and then 25 ways to instantly feel better, kind of touching on those happy hormones. So these are things that you can use, to help you put something into practice right away. So for those who wanted to work on their sleep schedule, right, maybe check out the better sleep checklist. For those trying to get more water in, check out the hydration tips that I have on there, because sometimes plain water can be boring. So find ways that makes it interesting for you, right? Makes it delicious. But just kind of starting with one small doable step, like you guys noted, and then we'll just work from there to build.
Yes, yes. So everyone will get this. We're going to send this out with the replay. You'll get access to this Wellness Jumpstart kit. So again, we're here to like provide you with support, whatever's going to be most helpful, inspiring for you. You'll get access to Megan's awesome gift and more to come, more to come. So I love that. It seems like we're already kind of landing and taking away some good action items from this. Thank you, Megan. That was wonderful.
Bring it over to Nicole now.
Yes. You want to jump in there,
Hi.
Nicole?
Wow, Megan, that was amazing. Thank you. I actually learned a lot from that. So thank you so much. Those were really great habit stacking ideas. Thank you. I am actually, a lot of what you talked about, Megan, is going to be um, kind of repeated and a little bit nerd. The MD in me is coming
Yeah.
out, getting nerdy today, you guys.
We're going into the lab. Love it.
Yeah, we're getting into a little bit of the labs behind some of these symptoms that Megan was talking about. So we can go ahead and start my slides. Perfect. Thank you. Okay, so Megan, you brought up burnout, and I think that this is such a paramount topic of discussion. We see burnout a lot in women these days. Our society, there's nothing wrong with it, but our society, we have a lot on our plates as women these days. A lot of us have kids, a lot of us have family life, we have dogs, we have pets, we have careers, we have dinner we have to make, we have PTA meetings we have to get to. There is so much that we're doing right now, and our schedules tend to be very filled, which can be very beautiful and at the same time can cause a lot of burnout. I want to remind us that burnout is something that we can see, as you can see in this picture of this girl on the left over here. I mean, she looks burnt out. I think what's fascinating about this concept of burnout is that it's showing up inside us too. It's showing up in our metabolism. It's showing up on a cellular structure. So as much as this woman who has these really cute heels, I think they might be Louboutins. She's like has this really cute outfit on. She looks great, but man, she looks burnt out. And the truth is, your cells are probably feeling the same way. Does anybody else feel like this girl right here? I do sometimes. I'm
Yeah,
just gonna,
up there.
Megan, you
I've been
look like
there.
you do. Yep, burnout is real. So, when I think about burnout, I think a lot about the hormones that are affected with burnout and metabolism specifically. So, insulin tends to be my area of expertise. I know, Amanda, you are really into all the hormones and thyroid too.
Mhm.
So when we think about metabolism, we think about energy, we think about the way that our body makes energy and how efficient it is with making energy. And one of the hormones that really plays into that is insulin. Next slide. Thank you. This slide, I hope somebody else will geek out with me as much as I like this slide. This slide is fantastic because of this graph right here. Megan, you brushed on this, and Amanda, you've been talking about this too. Labs will often look normal. I am sure I can't be the only one who has gone into my own doctor with complaints of fatigue and weight gain and acne or irregular periods or, my God, a myriad of different symptoms. And the doctors will run the labs and they'll tell you everything looks normal. And you're basically told to drink more water, take, such and such supplement, or, take a multivitamin, work out more, drink less alcohol. Has anybody else had that experience with a doctor? I'm sure. Yeah. And the truth is, I know that this is going to be recorded, so this is going to be out in the internet for the world to hear, but I've been that doctor before too. If we're being very honest, 10 years ago, that was the way I was trained. I've absolutely been the doctor who's told people you just need to drink more water until I started really digging into the functional medicine approach and really understanding that there is so much more. Hydration is amazing, don't get me wrong, we all need it. But there's so much more to the story other than simply drink water and take your vitamins. This graph that I have here is about insulin. But what I really want to highlight and what I hope the big takeaway is that your labs may be looking normal when you get them from your doctor, but things are happening beneath the system for years before that. So when I look at this graph, the first thing I look at is that fasting insulin level, which is that brown. And Amanda, yep, you're right on it, that brown one. 10 years before a diagnosis, that zero right there where you're at is the diagnosis of diabetes. 10 years before that, your insulin has already started going up. Your doctor's probably not testing insulin, but I can assure you that insulin is rising before you're diagnosed with diabetes. And that is one of the biggest explanations for why you feel terrible. And yet your labs, that A1C, hemoglobin A1C, is coming out normal. If we were to take one step further and really look at the metabolism of your cells in that insulin, for example, you'll see that that's rising. When we compare that to that fasting glucose, which is right above, yep, right there, 10 years before diabetes, that fasting glucose is pretty darn stable. It is a flat line, it is under 100. That tends to be the lab that your physician is looking at, that and that A1C. So as you can see, that glucose is flat. It's normal. It's under 100. Your doctor, 10 years before you are diagnosed with diabetes, your lab is going to be normal. And unfortunately, by the time that lab starts going up, you were right there, Amanda. Thank you. By the time that lab starts slightly going up, you've already been diagnosed. That's when you hit the point of disease. And that is happening not only with insulin, there are so many other hormones and nutrients in your body that are following this exact pattern. It might not be 10 years, it might be, 4 or 5 years, but the point is there are other things that we can look at, which we're going to get into. Can you go to the next slide?
Mhm.
Yes, there are other things that we can look at to determine the metabolic state of your cells. For example, fasting insulin, that's my number one. It's kind of my gold standard. I really like looking at that. It's the earliest warning sign of insulin resistance. I will often calculate a HOMA IR score from that fasting insulin and that fasting glucose. And then I will also look at these other nutrients like vitamin D, ferritin, and magnesium. How many of you guys have ever had those tested before? Megan, I can see your head shaking. Amanda, you have had those tests. Well, that's great. I mean,
Well,
yeah,
yeah, I mean,
yeah,
I learned that those you have to look earlier because
yeah.
unfortunately the conventional labs just don't go that deep.
I was just going to
They're meant
say
to
from
have.
a yeah, from a clinical perspective, I can't say that this is ever on a standard blood panel. And so then you as a patient, you would have to advocate for yourself to,
Mhm.
ask to even have that drawn if they would do it in a clinical,
It's
which is disappointing. Hmm.
it's so sad. I'm going to actually get into a little bit of the reasoning behind that next, but I think that these nutrient markers, this fasting insulin, this vitamin D, this ferritin, you often have to advocate for that. And it's these labs are such fantastic markers of how your body is using energy and the way that your metabolism is functioning. And if we can start looking at those little micronutrients, you can start to get some ideas of where your fatigue is coming from, where your hair loss and your low energy could be coming from. It could be coming from a lack of these basic nutrients that we have testing available for. Megan, you talked about silent inflammation, and I think this CRP is fantastic. And I completely agree with you that silent inflammation, if it's just a one-time inflammation because you actually hurt something, that can be normal. What we look at in this particular functional medicine space, and when we're looking at metabolism, we really look at these smoldering, low grade elevations in CRP that have been going on for a long time. So I like to trend labs on my clients so I can really see how long have you been dealing with this? How long has your CRP been slightly elevated? Because that's a fantastic sign of how long somebody has been suffering with low grade inflammation that may not have been addressed. Okay, next slide. Okay, so hopefully by now some of you are saying, why the heck don't doctors order these things? And the truth is we have, and I hate to say this because all of my, we're all trying to do the best we can, but we have a systemic failure. As somebody who practiced traditional medicine for 10 years, I also trained younger doctors. So after they graduated from medical school, I spent 7 years training them. And what I've found is that what we're doing is we're teaching doctors to diagnose and manage disease. We're not really teaching doctors to catch disease early. And it's unfortunate because, yeah, prevention is key. It's unfortunate because we are missing these key pieces. All of you guys who are here today on this call, who are saying you're suffering with all of these symptoms that Megan brought up earlier, yet your labs are often coming back normal. Unfortunately, your doctor is not really trained to do a whole lot about it until the labs really start coming back abnormal and pretty darn abnormal too. Just to give you an example, that CRP, when we look at the guidelines that have been put out about CRP, the guidelines actually say there's not a whole lot to do about it until that level reaches about 7. Yet, and Amanda and Megan, I'm sure you've seen tons of people with slight CRP elevations, and the three of us, we know what to do with that. We know darn well what to do when that CRP is 1 or 2, but we're not training our physicians to know what to do with those slightly elevated CRPs. Unfortunately, a lot of these guidelines that come out are being put out by societies like American Society of Gastroenterology, Endocrinology, and oftentimes the research that they're using lags by about 10 years, is what I've found. So
Mhm.
hopefully in 10 years, some of these guidelines will be shifted and they'll start to address these micronutrient deficiencies. But as of now, those guidelines aren't there. Insurance companies often won't pay these either. So what I mean by that is if somebody is coming into me with a feeling fatigued, feeling low energy, one of the classic labs I love to get is a vitamin D level. or a ferritin level, possibly even magnesium, like we talked about. Yet, insurance companies will not cover a lab from a traditional doctor if it's under a diagnosis of fatigue, so a symptom based diagnosis, unfortunately. So these are all some of the reasons why insurances, doctors aren't trained. These are the reasons why you'll see that a lot of your traditionally trained doctors don't really order this stuff. I'm going to stop for a second. Is any of this kind of resonating with anybody? Does anybody have any questions or comments about this? This hits really hard for me, maybe because I'm in that space, and I'm sure Megan, Amanda, this is probably one of the reasons why you may have left that type of practice.
Mhm. Yeah, and I know one thing I want to add here, it's just a kind of a little side tangent to the conversation, is what I talk about with a lot of the women that I work with is I think we're blessed because our generation is stepping into this awareness that the medical system, as it has historically been set up, is inadequate for longevity, for resilient health, for that true vitality, which is not to be a knock on the system. It's exceptional at acute care and really esoteric or unusual like treatment management of disease. Honestly, it's exceptional. But for the individual, I'm like, that puts us in a power and that puts us in a place of choice, which usually means we get to proactively advocate for ourselves, proactively invest in our health in a different way instead of relying on insurance. Because if we're relying on insurance, to your point, Nicole, it's usually covering it or picking up part of the cost once it's already a disease, right? But if we want to proactively build that health, we have more ownership. Like in a sense, there's more personal responsibility that comes with the freedom of having greater health for a longer period of time, right? It doesn't responsibility with freedom comes responsibility, and it's just being extrapolated to the arena of our own individual health experience, right? So I'm just kind of going off on a tangent, but I'm curious, like, how is this resonating, or maybe not resonating with anyone here that's listening and that's kind of tuning in?
I think too, I agree completely. I want to just point out for all of you who are here, having the awareness or the desire to find that awareness to be able to be proactive in your health by being here today and by trying to figure out, the preventative proactive approach, I think is a really huge step for all of you and will bode so well down the line to get you that longevity, that quality of life that you're looking for outside of traditional medicine. And so I just want to commend everyone here too, because I think that's a
Yeah.
huge first step in just saying, hey, maybe there is a different way, or maybe there is something further that we can do, I can do to help myself feel better. So I just think it's important to recognize that too.
Absolutely. I mean, yeah, you ladies are the ones that are here wanting to be empowered and informed and having good questions to even bring to your practitioners. Like this is amazing. And I love that you recognize that. Let's see, Robin said, never knew where my hormones stood until I started working with Amanda. Yeah, but we've been working together, or I've been working with an endocrinologist for 15 years, having a pituitary. So that was the reality for you, Robin. Like you'd been working with an endocrinologist for 15 years, and it's no knock on this practitioner, exceptional practitioner, I'm sure, but working within the limited scope of what was available and really in the scope of care that's standard for that endocrinologist, right? And sometimes just you took the initiative to, let's say, hey, I want to dive deeper. I want to have more guidance, more support, more knowledge so that I can approach this more strategically, candidly speaking. Can anyone else relate to this? I know Felicia, maybe you mentioned that you've worked with a functional doctor. Anyone else have any experience where it's like, I'm recognizing the opportunity to go beyond the standard of care in conventional medicine? Yes, no, well, something to think about, something for us
Yeah.
to,
Well, when we started, actually, if you want to go to the next slide, when we started
yeah.
today, Amanda, you brought up something interesting, which I really loved, which was setting the intention. And
Mhm.
as I was creating these slides, I really was thinking about the intention and what I wanted to impart. And I wanted to impart not only a little bit of background and knowledge of where kind of the lapses are in our current system, but I really hope that at the end of today, there's a feeling of empowerment
Yeah.
because we have been, I don't know if any of you have done this. My mother comes from the time of like, no news is good news from the doctor. And it's so interesting because I come from a time today where it's like, no, no news is not good. No news is just no news. Let's take ownership and responsibility and let's like really understand where our bodies are for that longevity, for that vitality. And so I really hope that after today, I don't, I want everybody to leave here with a sense of, it's not in my head. There is something going on. There is a physiological and a biochemical reason for these things to be happening. This crash that happens at 3 p.m. where I need that extra cup of coffee, or waking up at 3 o'clock in the morning just out of the blue, can't go back to sleep, sugar cravings, brain fog, irritability. This one actually hits really hard for me. I know many of you were mentioning it before in the comments, but irritability was probably my biggest sign couple years ago when I started really diving into insulin resistance, metabolic health. It was irritability, and my kids were kind of walking on eggshells, and my husband kind of pointed it out, like, what's going on? Like you're pretty irritable. And that it's not coming from nowhere. It's quite literally coming from within. It is. There's cells, there's something happening. It's not just random. It's there. There's a reason for it. I didn't need more water. I needed to fix my insulin resistance. So, with that said, I would love to highlight the fact that even though the labs may not be showing it, your traditionally tested labs may not be showing abnormalities. Your symptoms are your body's way of telling you something is up. The gift that I have, I think it's attached for everybody, or there's a link to it, Amanda,
Yep. I was
is
doing that.
a blood sugar symptom decoder. So it really goes through all of the symptoms that are associated with metabolism. And if you've got three or more, that's really a sign that there's something deeper brewing, and it's not in your head. Okay, I think I have one more slide. Okay. Kind of in line with Megan with habit stacking and kind of starting off with a couple of habits that we can do. The first couple of habits that I really love to center on are stabilizing in the morning with protein and resetting overnight with a small fast. So, the reason that protein works beautifully, and the reason that I picked these specific ones, was because I really wanted to align these habits. And when I'm working with clients, I'm working with people, we really align the habits with the circadian rhythm. So, protein in the morning really helps signal to your body that it's safe, and it really helps fuel the body for the rest of the day. I have noticed with myself and my clients that once we started getting that 30 grams of protein in the morning, those sugar cravings, the irritability, the hunger that used to hit at like 4 or 5 p.m. wouldn't really happen as strong anymore. And it's because we're starting off the day strong. Similarly, resetting overnight allows the body to decrease that insulin. It allows melatonin to rise. It allows your body to be primed for sleeping. And the way that we do that is by stopping eating. So I don't know how many of you, I used to do this where I would maybe 8 p.m. My husband and I were so guilty of this. 8 p.m. Our kids finally got to sleep, and we would go into the pantry, and all the things that we don't let the kids eat during the day, we're eating. We used to eat those things all the time. We stopped doing that, and that is paramount for resetting your rhythm overnight, allowing that insulin to go down. It's actually overnight is the time that that silent inflammation can heal. Overnight is the time, like I said, melatonin is rising, cortisol is lowering. It's fantastic, and it really helps let the body heal and calm if you can do a fast. Not everybody will be able to do a 12 or 14-hour fast to begin with, and one of the things that I really like to work on with my clients is helping them get into that longer fasted window. It takes time for many people. It's not easy to do, but it is so crucial for healing the body. I don't know if any of you are currently doing that. Does anybody else have issues with fasting or getting that morning protein? Any of these resonate with anyone?
I will say for me, Nicole, so a couple things you said are so key is like the biggest shift is when I had protein in early in the day, like for breakfast. Now, it doesn't necessarily mean like if I wait and have breakfast later at like 11, then it's like throws off the thing. And by the time 6 o'clock happens, like I haven't had enough calories, good nutrients. So it's like getting that in early for breakfast, usually before 8 a.m., before 9 a.m., but then stopping. So I used to be like you a long time ago. I used to have like, I have a sweet tooth. I love chocolate chip cookies. They're like my all-time favorites. So I used to have cookies at night before my kids would go to bed or after they would go to bed. That was like my calming, winding down. And I was like, this is actually not helpful for my body's physiology, but it felt really good in the moment. But having the like after dinner, like kitchen is closed after 7 p.m. or like after dinner, kitchen is closed, like not eating anymore, so that you have that window between like 7 and 7:30, 8 a.m. or whatever. That I think it's important for me, the timing of it, like match the fueling your body for the day, but then when the day is winding down, like stop fueling later. You know what I mean? That really made a difference.
Yeah, no, I think, and when we think about, and again, totally nerding out, I'm sorry, but when we really think about cortisol rhythms, insulin curves, and all of the hormones, your thyroid hormones, all of them, when you really look at the curves throughout the day, we have found that eating to align with those hormones, it works really perfectly. Whereas I think in our society we kind of flipped that a little bit, and it's okay, it happens. But some of us flipped that a little bit, and now we just have to, reflip it back to really match biology. So I love
Mhm.
that. Christina, you brought up a really interesting point. You talked to your OB about hormones in perimenopause, and truly, I can really talk about how the doctors just are quite literally not trained to manage hormones like that. In the 90s, there was a really big shift against giving
Mhm.
women estrogen and progesterone because there were some questions of whether or not it was causing clots in women. And it turns out that there are certain forms of estrogen, particularly horse estrogen, that we were giving women in the 90s that was causing clots. And so, unfortunately, estrogen became very black box labeled, and
Mhm.
it hasn't changed yet because even when I was training physicians up until a year ago, they're all very hands off. It's kind of a very taboo topic
Mhm.
in that traditional space, but uh, yeah.
Well, to your point, Nicole, the data before it can really be mainstreamed medical standard of care, it's usually 10 years outdated. Like it's 10 years lag. So that you're right, that study that came out specifically about the horse estrogen and some of the effects really didn't necessarily have some of the full picture of, you know, different types of estrogen when it's paired with it, how it affects and what really was the underlying risk for cancer in these women aside from the hormone. So it's since been further dissected and kind of taken apart and really recognized the limitations of how that study was initially presented. But that hasn't necessarily become the new standard of care, and it probably will be another 5 to 6 years before it really gets rectified and they have more different types of evidence to change that.
Yeah.
But I love what Christina said. She said, I'm not a morning person. And this is where I'm gonna lovingly invite, if Christina, are you open to a little bit of like coaching and guidance around this? Yeah, thank you. She gives me the thumbs up. Just like Nicole said, that is actually very, very common, and there's a reason for it. Because studies have shown, especially for women over 40, as our estrogen and progesterone levels decline, as we're in the perimenopause phase or even menopause, once we've officially gone a full year without ovulation, without a menstrual cycle, when those levels are lower, our how do I say, our sensitivity to cortisol is even more obvious because we don't have the buffering effects of estrogen and progesterone. Cortisol, as we know, is the number one primary stress hormone. Not in a bad way, it really helps the body to adapt and to respond to different circumstances in life. We also have this cortisol awakening response. So it ideally peaks shortly after you wake and then starts to taper off throughout the rest of the day. Now, what's interesting about that is we want to have a really nice, healthy cortisol awakening response in the morning because that strengthens the immune system. It keeps autoimmune dynamics at bay. It's really, really valuable to have a strong cortisol awakening response. However, studies show that for women over 40, if they routinely enter that cortisol awakening response, so within the first, I don't know, 180, or I'm sorry, 80 to 120 minutes or so after waking up, if you enter that peak point fasted, so you have had no nutrients in your system, it's going to signal to part of the brain to purposely suppress hunger cues and suppress thyroid function, which controls metabolism, and to kind of put on alert your stress response, that sympathetic fight or flight response, for the rest of the day. So it makes sense because if you've gotten in a pattern of not having breakfast early, it's purposely suppressing hunger cues. So you're not going to feel hungry. The challenge with that, and it's going to kind of go into some of the things that I'm talking about the rest of the hormone cascade, is now you are not fueled for the active part of your day, biochemically speaking, and that's going to put your body's stress response on high alert the whole day long. And it's going to be really critical. If we're in sympathetic fight or flight all day long, that's going to impact some of the other things that I'm going to show, we're going to talk about. So it's one thing, it doesn't necessarily mean you need to have a huge big breakfast. Like some people are like, I'm just not hungry. And I'm like, could you eat a hard-boiled egg? Could you grab a piece of toast with some almond butter? It doesn't have to be huge, but could you put a little bit of sustenance in before that huge cortisol awakening response happens so that your body is like, okay, a little bit of fuel here to run on and to get going on. It's kind of like put a little gas in your car before you want to drive it off down the road. Does that make sense?
And just to tag onto that really quickly, one of the things I actually love when my clients start coming to me and saying, I'm hungry in the morning now.
Hungry. Yeah.
That is like, you're healing. When
Your body's cues are coming back on board. Yes.
Yeah, exactly. So it's interesting because it was a little taboo for a while where the intermittent fasting was often happening in the morning. And so people were, this was, maybe 10 years ago, I think people were really talking a lot about like skipping breakfast, intermittent fasting. And then as we started learning more about the hormone cycles, it was like, don't skip breakfast. Now try to like just cut off yourself around 6 p.m. if you can. So you have the fasting in the evening. So
Yep.
yeah, love
Exactly.
it.
And actually, it's different for men. So the studies are less different. So men can get away with more of the intermittent fasting, skipping breakfast for a lot longer because their hormone trajectory is much more like gradual change. Whereas for women, we kind of have this pretty substantial drop off of our buffer hormones. So the effects of cortisol become much more influential pretty rapidly. So it's different for men and women. And the initial studies did not distinguish between men and women. Now they've done some like more new research that shows, oh, whoa, we shouldn't just make these general guidelines of skip breakfast for everyone. So yeah, it's good to know. Okay, Christina said that makes sense. Yeah, I'm glad. Okay, so something to think about and play with of what could that look like for you. Awesome. So is this feeling inspiring? I'm curious. I'd like to just check in here with your intention of what you came here with today. Do you feel like you've had that, like, okay, I'm making progress, I'm learning some, or I'm kind of getting inspired, or I have a new idea? Is there anyone who's like getting some traction, really seeing this as helping you to reach your intention? Robin says, interesting, because I never used to eat until after I walk, but since I've been eating a snack before my walk, I now am hungry earlier. Yes, exactly, Robin. That means your body is responding and adapting because we want to have hunger cues. Hunger cues, if we learn to listen to those and we use those as input of how we nourish, that's really, really healthy. That's good. I love that. Okay. Anyone else want to chime in with kind of your intention for today and what you've learned so far, what's coming up, what maybe stood out to you. I love to get this feedback. And then we can continue on, continue on. I see some people typing in, letting us know. All right. All right, I'm going to keep on moving on. Feel free to share in here with what's standing out for you. Okay. So when we think about, again, and some people are sharing, oh wait, here, I'm going to go back to the chat and see. So I'm going to work on eating something in the first 80 to 120 minutes after waking up. Yes, love that for you, Christina. Felicia, love the practical pieces, especially about eating early. Good. Good. This little needle movers that make the difference. So this is interesting, right? Kind of what we were alluding to earlier, the truth about midlife healthcare. Women over 40 are biologically more complex. You all deserve more than just the basic standard of care. As Nicole just explained, why that standard or that basic lab is outdated and quite frankly, insufficient. It's not going to help you build resilient health. It will catch once disease has happened, but those are two very different things. We're talking about building health, preventing disease, right? So this 2022 study in JAMA International Medicine found that women's symptoms are less likely to be taken seriously and more likely to be attributed to emotional causes. We're going to talk about emotions a bit too, because they play a big, huge factor in our overall physiology and our hormone health as well. Most conventional lab panels are designed to detect disease, not imbalance. As Nicole was just saying, they miss the early warning signs that your body is struggling. So again, this is reiteration, but it's important to note. And I'd like to share this graphic because I think it gives a level of prioritization or perspective that many of us perhaps haven't considered. I know some of you have worked with me and you've seen me talk about this because I show it often. I think it's really, really powerful. But when we're thinking, actually, before we even dive in here, I'm gonna give a little story analogy because I think this is kind of helpful to remember. When we think about how we approach our health, it reminds me of this analogy of broken boats and bodies. What do I mean by broken boats and bodies? Well, I had a functional medicine trainer, a teacher, when I went to school for functional medicine. She had this analogy, and I'm like, oh, that's so powerful. And she talked about how, for many health and wellness professionals that have the best of intentions, it's like they have a job where they come to the side of the river every single day. They're stationed at this spot on the side of a river. And every day there's all of these broken boats that have like holes in them, that are capsized over, that have some wooden planks ripped open, that have bodies flailing around in the water, drowning, and they're trying to struggle and get up, and they have scrapes all over them, and maybe they bang their head because they had a concussion, and they're like, holy cow, there's a lot of people we need to help here, and boats that we need to repair. And so every day, these healthcare workers are working diligently and working tremendously hard to pull out the bodies and to resuscitate and to stitch up the scars and the broken bones and fix everything. And then we have a whole shop to repair the boats and bandage them up and retool them. And then after a few weeks and months of doing this, it's like, oh my gosh, like, what's going on? Like, we need more help here. This is every single day. It's the same scene over and over again. So maybe we need to build a better repair shop. Maybe we need to have more stitchers and more, casts to put on the broken boats. And eventually, some of the healthcare practitioners are like, you know what's causing all these broken boats and bodies every single day? I'm gonna take a walk. I'm gonna walk down the river and go about half a mile upriver and see, why are we seeing this every day? And when you take the walk the river, you see, holy cow, there was this precipitous waterfall. No wonder. And when I'm watching, there's this waterfall where some of these people go barreling over the waterfall and their boat crashes. They're not prepared. They don't have the skill to learn how to navigate this rapid. They don't have a helmet on. They don't have the right type of boat. No wonder we're finding them at the bottom all banged up and needing help, and their boat is capsized. And if I look even further up, there's no signage, there's no postage like, don't continue. If you continue this way, there's a 25-foot drop ahead. But as that practitioner walks uphill, they see, hey, you know what? Not everyone is having that same outcome. There's some people that actually look like they're professionals. They've been trained. They look like they're doing this for sport and for fun. They're in their little thing and they're paddling hard and they put their helmet on, and they're the ones that go over that waterfall, make it and just keep on sailing by. We never see them at the bottom of the broken boats and bodies. They have been trained, they've been prepped, they've practiced, they're enjoying this. They're actually living this for adventure and for fun. Well, what if we were to apply that same type of approach to our own decision about our health, right? Instead of doing what we talked about is like kind of waiting until things get to that bottom of that drop and there's all these broken boats and birthdays around. You ladies are here. You're doing this. You're in the place of like, go upstream and look for the signage and kind of maybe learn some new skills and get for equipment and know what I need to navigate this terrain of life. Let's be honest, life can be pretty hairy sometimes, but I want to navigate it with grace, with skill, with adeptness, and actually maybe even become like a little bit of an adventure, right? So it's kind of fun to think about it. I like to put it in that context of like, I invite you to step into the rapids and be like, I'm in the rapids of life, so I'm going to tool myself up, I'm going to skill myself, I'm going to get the knowledge, get the support, and get the resources to navigate this gracefully and perhaps even with a little bit of fun. All right, so that's kind of a little perspective. And let's jump back in here to think about when we think about hormones in particular. A lot of people think about hormones, they think about cortisol, right? The stress hormone. They think about insulin, as Nicole was just talking about, that helps regulate our blood sugar and our energy. We think about thyroid. Thyroid is a big metabolic in terms of regulating kind of the thermostat of the body, the overall temperature in the body. So a lot of different things. But when we think about our hormone balance and what drives hormones in a large part, it's this axis of interconnectedness. I call it the HPATG axis. It's a long acronym, but H stands for hypothalamus. Hypothalamus is in the brain. This is what is responding to our thoughts, our beliefs, our emotions, our perspectives. So really, this is the meaning that you're giving to life, the meaning that you're giving to that conversation you just had with your son or daughter when you were frustrated this morning, the thought that you have about what's possible with your project at work, right? The belief you have about how well your body can shift and change and transform to give you the energy to get the good sleep that you desire. All of these things start with and are affecting the hypothalamus. Then it goes to the pituitary, also located in the brain. This is where we have a lot of neurological and endocrine tissue. And the pituitary's job, I think of it as like to kind of like be the gatekeeper of the internal environment. It says like, okay, what's going on internally? What messages are we getting from the hypothalamus? How do we need to respond and be prepared to handle life and to think about it? And what's going on with our hunger cues? What's going on with our nutrients that are coming in, with our sleep? It kind of assesses like, what's happening inside this bodysuit that we have on. And it signals down to the adrenals. Based on the input from above, it will tell the adrenals, which control stress, cortisol, and neopinephrine, epinephrine, think of the stress response in the body, and immune response in the body. That will signal to the adrenals of like, okay, is everything A-okay? We are happy, we're in a good place, we can be creative, we can be graceful, we can be calm, we can be patient, or are we like, holy crap, there may be an emergency here, we need to be on high alert, we need to be prepared to fight or flee. That's what I call sympathetic stress response versus the parasympathetic, life is good, we're pretty comfortable here, okay, this is kind of cool, I can get creative and see what other options are available, or think of this conversation in a new way. Maybe the other person was just having a hard day and that's why they were talking that way, right? That takes creativity. That takes us to be in parasympathetic. The adrenals then signal to the thyroid. And again, thyroid is going to help to regulate our metabolism, our ability to burn and utilize energy effectively, to be able to optimize our weight, right? Be able to ability to regulate our temperature in our body. And then it finally goes down to the gonadal tissue, the ovaries, right? The reproduction. So when people have trouble with reproduction, it's like we got to go up, up, upstream. But what I like to show about this is the very tip top of this hypothalamus, right? Thoughts, perceptions, beliefs. Life is about 10% of what happens to you and about 90% of how you react to it. Two different people. I'll give you a true story. I have a neighbor down the street. Now, we moved into this house 20 years ago, and this happened to them 22 years ago. So I've since took her. I wasn't here living in this house when this happened, but they had a house that unfortunately caught fire and burned to the ground. Completely devastating, right? For anyone thinking about losing your whole home and your belongings and everything, devastating. And granted, time can heal a lot of things, but this was about 2 years later when we moved into the house. I'll never forget talking to her and meeting her and whatever. And she's like, you know what? She's like, yeah. And she's like, it was definitely hard. But honestly, it was like the biggest blessing to see how our community came together, to see how we were able to rebuild. We actually rebuilt our house and now have our dream home. Like, it was amazing to see how a circumstance that could be defined as a traumatic event and continue to negatively affect her and the family for the rest of their life. Because we often think about things that happened in our past that we continue to think about and ruminate about or relive that could continue to negatively affect that whole HPATG axis, or because she gave a new meaning to it of surrender. I don't know why it happened or how it happened, but actually I'm able to see the blessings that came from it. She has a new meaning associated with that, a new thought about that experience. So that is still, again, signaling to her whole physiology a completely different relationship with that circumstance, right? Now, this is not to make anyone right or wrong, because we all have difficult, hard things in our life, but I'm just presenting that as another element to how we approach our health. Yes, absolutely, the nutrient is critically important. The movement is important. The sleep is important. It's all part of the process. But at the end of the day, if we are not really also looking at our thoughts, beliefs, and this is why I use neuroscience with my clients to help them rewire the brain. Because if we don't kind of change some of the hardware about our past lived experiences, we're going to constantly trigger that fight or flight, fight or flight, fight or flight, whether we want to or not, right? So let's look at this and how it happens and how other hormones affect our bodies. So disease happens when your cells do not have adequate vitamins, minerals, antioxidants, and nutrients to meet your daily demands. Said another way, if your body is in sympathetic fight or flight response majority of the time, because even running in the background, there's a little bit of underlying frustration or judgment, self-judgment, or resentment, your body is on overdrive. It has a higher demand for all of these things because it's working harder. It's like cranking the engine up majority of the minutes of your day instead of having it kind of on idle, right? So we need to have, when we think about our downstream hormones, and now some of us have been through menopause, so we are not necessarily going to have the peak levels of estrogen or progesterone that we had at one earlier part in our life. Those were buffer hormones, but that means we're going to be more sensitive to cortisol, perhaps even more sensitive to testosterone flares or imbalances. But really, what I want to show here is if we don't have adequate intake each day of vitamin A and several different B vitamins, in addition to our body producing thyroid hormone, it's very easy to see how cholesterol can kind of pile up and get backlogged and elevated cholesterol, because that cholesterol is designed to be made to be used to create these other downstream hormones. But we need to have some of these cofactors to help partner with in order to use it effectively, right? So it's, again, kind of seeing that there's bigger pieces of the puzzle here for how everything works together. Felicia says, I'm jumping on a call. Okay, no worry. You can definitely catch the recording. Yes, yes, yes. So good. So one of the things I want to share with you, kind of like, you're going to get this from me, you're going to get lots of gifts, but one of them is comparing your annual lab work guide. It basically just shows you how to think about what your lab work is, the conventional ranges, what are more functional, narrower ranges, and what are some other options that you can look at. Because when we think about what does running labs actually means, it usually means the standard labs, right? Thyroid stimulating hormone, TSH, lipid panel, some blood sugar markers, like Nicole was saying, you usually get a hemoglobin A1C and a fasting glucose. Those are the two that are kind of late to the game instead of fasting insulin or some of the other metrics she was sharing. You usually get a complete blood count. Sometimes you get vitamin D. Often, hopefully, that's a very valuable marker to get. Functional testing that I like to look at deeper to see, like, okay, is the body able to take in and absorb these nutrients? Am I getting enough of some of these key players to meet my daily demands? Well, we can look at that from some deeper layer of testing, right? Some of the testing is urine micronutrient testing. When you measure urine, you're measuring the metabolites of what actually made it inside the cell, had a cellular effect, and then the body was able to excrete the metabolite. So it shows us, it's kind of like your body's nutrient report card. Do I have enough vitamin A? Do I have enough of these B vitamins? Do I have enough magnesium? Are my cells getting what they need to meet the daily demand? Or is it not even, it's like I'm not even putting enough gas in the car and then expecting it to function at a high level, right? Another one that I really like is the 24-hour urine test. This is like getting a detailed movie of your hormones instead of just a blurry snapshot. A lot of times when we even do have our hormones tested, it's blood tests that's like a really snapshot in time, rather than the 24-hour urine gives you at least the full day, so you can see the whole cortisol curve. You can see, how is my cortisol awakening response? How is my melatonin? You get a snapshot of where your body is processing things like estrogen and progesterone, and how your body uses it. So again, getting more detailed information, I just want you to be aware of how you can do these things and then be more strategic with your support. But when we go back to really, what is that root cause? If we're walking upstream the river with the broken boats and bodies, what's the root cause? A lot of times it's nervous system dysregulation. The nervous system is running in fight or flight, sympathetic, all day long or most of the day, not often enough being able to switch into that parasympathetic rest and digest and heal function of the body. Rebuild health happens in parasympathetic activation. So we get stuck in this dynamic, this loop of dysregulation. Dysregulated nervous system or low range of capacity looks like, hey, you could have the best plans to start a new diet, to join Club Pilates like Corey did, right? To even walk away from this training and say, hey, you know what? I'm going to focus on getting my food in the morning or whatever it is, or adding in hydration, all these great initiatives. And that's awesome. I love that for you. And here's the reality. Oftentimes life happens. Our nervous system becomes dysregulated. When we become dysregulated, we fall back into the familiar patterns. We lose control. We will default to the habitual patterns, right? That's not a judgment. That's not to self-criticize or shame yourself or have guilt. It's just to know how your physiology is wired for safety. Safety is in familiarity. So then we tend to have the bad choice. We either binge eat, or we skip the meal, or we go to stay up late because we think we've got too much to do. We can't go to bed early, whatever the pattern is, right? And then we feel bad. We shame and guilt ourselves, which just goes back to that thought that HPA backs us. It dysregulates the nervous system even more. And then we have kind of a loop happening again and again. So let me just ask, does anyone feel like they can recognize perhaps, and again, this is not about shame, because listen, I am there with you. I have been there, and it's the continuing to do the work to expand the capacity so that your nervous system has more wherewithal to be able to navigate the ebbs and the flows of life with a little bit more bandwidth. Can anyone relate to this, where it's like, oh man, you know what? Sometimes it's my thoughts or my own beliefs or my own things that kind of just throw me off. Joanne saying yes. Megan saying yes. Anyone else? Yeah, Christina. Yeah.
I think too, Amanda, something I've noticed with clients and myself as well, is a lot of times if we become so conditioned to it that we don't even recognize it. So I love, the cues you were saying on how to even create that awareness of the dysregulation, right? Because a lot of times it's so natural to us that we don't even realize it until we recognize, oh, wait, this is not normal. to be
Yes.
experiencing regularly, right? So just that awareness is huge.
We're in it, right? We're in
Right.
it that we can't even like step outside of it to see it for sure. Absolutely. Yeah. That's a big piece. So what do we do with that? I mean, I think part of the fact that you're here, the fact that you're having this conversation, that you're looking at it again, I'm going back to Corey, right? Corey is the woman that I mentioned at the beginning of the session. We're working with her currently. When she came to me, she was totally in why bothersome. She's like, Amanda, I've like tried these things before. And literally, I don't know what's going to be different this time. I don't know what's going to be different. And I said, well, you're here with curiosity, like something deep within you is like, there has to be more, there has to be something else. And are you open to some new approaches, some new guidance, some new learning about what it is, understanding your body and having more self-compassion? Because it's like, oh, some of the stuff is literally beyond our mental control. It's like physiology is driving the system. It's not like you can think your way out of it, right? If we get to a place of where we're too depleted, physiology is driving you, not like your conscious choice. So recognize, have compassion for yourself and forgiveness and, self-care. And then also have ability to really be a little bit more strategic, cut out the noise. We live in the information age where there's so much information coming at you about you should do this, you should do this, you should do this, not this food's bad, this food's good, whatever. And it gets overwhelming where it's easier to just kind of be like, I don't even know where to start. I don't even know where to start. Like I'm kind of frozen and stuck, right? So what I'd like to say is like, get some data, know where your body is. And I'll go back and share this. This is why one of the beautiful things, I love it, where we talk about, there are things like this micronutrient test. This is one of the things that I do with all my clients, but you can see, again, how is your vitamin A? Are you meeting your needs? Or are you barely just getting by? Yellow is kind of like getting by, but you're definitely not feeling fantastic, right? How are your B vitamins? Oh, wow, no wonder. And you may be thinking you're eating really healthy food, and you may be, but it may not be to the extent that is required for your body or that your body will thrive and build health with. It may just be barely kind of getting by, but not thriving, right? You can see this is a prime example. Another woman, Tamara, came to me. She's like, I eat very, very clean. I'm gluten-free, dairy-free. I've been eating like healthy, clean diet, whole food diet, Mediterranean style diet for 5 years. Why do I have brain fog? Why do I have insomnia? Why do I literally have to take an aspirin a day because my aches and pains are so bad? Chronic low-grade systemic inflammation. Well, her body doesn't have the antioxidant status that she needs to be thriving, right? So what do we do with that? Part of it is, I love, just like Megan was saying, going back to the basics, the PFFV or PFFC, however way you're going to remember, but thinking about these meals strategically is going to bolster your bandwidth. Another thing that's really valuable is getting support with the mental emotional perspective, using brain science. And this is what we do. One of our steps in our program is reset your thinking so that you can start from the hypothalamus level to calm down the brain in more instances so that your body can better digest. So it has the capacity to be in parasympathetic and absorb those nutrients, so that when you're eating a healthy food, you're going to get the benefit of those foods instead of it being in fight or flight. When you're in fight or flight response, what you're eating is only going to be marginally absorbed. A lot of that is going to be moved right through the system because the body's like, I'm prioritizing digesting this down. I got to prepare for this battle that I may have to fight, even though it's in our brain, right? It's not a battle that's happening in front of you in this moment. So part of it is, if we don't infuse and incorporate the practices that are going to help us to rewire our brain to create new associations and relationships with circumstances, people, situations, beliefs, and identify where we're holding ourselves back, where we're getting kind of that. I'll never forget. A coach said to me once, I'm like, oh, this one client or this one situation always pushes my buttons. And she goes, well, don't have such a big button out there that's so easy to push, right? Easier said than done, but there are tools, there are ways that we can do this. So one of the key things, and Robin's already alluded to this, I think Joanne does this, but tapping. I love to use EFT, emotional freedom technique, tapping. as a practice to help your body release some of the internal emotions that are trapped in our nervous system. They quite literally are stuck in the nervous system from past experiences. And if we don't ever look at them, if we don't ever release them, they're going to continue to trigger. Yes. So Deanna says, I love all of this. Thank you for your time. Need to hop off and we'll follow up. Yes. Awesome. So good to see you. I would love to turn it over for Q&A, for questions. Great to see you, Deanna. Thanks for coming. What questions do you ladies have? I feel like we've covered a lot of different pieces here and kind of brought it all together. But what's coming up, or how can we best support you with anything else that you are sitting with today, have on your mind, would like insight on?
I'm curious if anyone felt like they got some maybe insight or answers to that intention we set back at the beginning. Do you feel like, oh, this was really helpful towards that? Is there anything that you took away to where you're like, okay, I feel one step closer to being able to achieve that intention?
Seeing that Christina said I did the urine test before I started the stress hormone supplements. So that was probably helpful for you to know, like, was that showing your cortisol curve? Yep. Good. So you're getting some more of the data. Yeah, definitely. Anyone who wants to unmute? I'd love to have some engagement, interaction here. Christina, do you want to share, like, what's the biggest takeaway or what's landing with you?
I'll unmute. Well, I guess really the eating thing. So like forcing myself to get up and eat in the morning, and the schedule is always wonky. So when I was working full time, I was getting up and eating and doing that. But since I was home with my kids, it was different and I wasn't eating right away. So just getting back in the habit of making myself eat in the morning. Because yes, I do find that when I do eat, I am hungry later in the day. And I always thought that was more of a bad thing, because then I was hungry more, like I wanted to eat more. But then getting in the habit too of not eating as late at night, because I was raised to be a late eater. My parent, like, we always ate dinner late. So trying to eat earlier, and my husband tries to get me to do that, but it just, depends on what's going on. So I guess shifting the schedule of eating, eating earlier in the day and eating not so late at night.
Yeah, I love that. Well, thank you for being open and vulnerable to share this, because I think many people can probably relate, myself included. Are you open to perhaps a little bit of coaching to help give you some guidance to get over any blocks to making that happen consistently?
Sure. Yeah, I am. The hard thing also with me with the eating part is, like, I'm not a great cook. Like, I don't like to cook. I don't enjoy it. So, preparing meals that are healthier, have everything I need. Like, I'm not good at that. Or
Yeah.
if I do try, it takes me a long time to make things or do things where I feel like I could be doing other things with my time than
Totally.
making
Yeah.
meals.
Absolutely. And part of it is, so one of the exercises that I love to do with clients is I have them, like, basically and we can do this on meal planning or meal prep or anything that is like, feels like, oh, I have a knowledge of what would be good for me, but my execution of that does not match the plan, right? Like, where there's a mismatch of, like, I know what I should do, but I'm not doing it, type of thing. And usually it's like, okay, there's some opportunity there, is to take a piece of paper and draw a line down the middle, and on the left hand side bullet point all of the reasons why doing what you would like to do, or what you should do, or would be good for you, is hard, right? And to be honest, like you said, like, maybe busy schedule, we're busy with the kids or whatever until night, I don't like cooking, it takes too much time, there's other things basically, whatever they are, bullet point them all down on paper And the interesting thing is, a huge part of our health transformation comes when we transform our identity of how we see ourselves in this world. And like, for example, are you a mom?
Mhm.
You have kids.
Yeah.
Part of your
Two.
identity is as a mom. You
Yeah.
will never, if somebody comes up to you and is like, oh, no, you're not a mom. Like you would never, ever, ever show up in the world in the way that goes against being a mom to your children. Like it will just inform your decisions, it will inform your actions, it will absolutely drive how you think about your priorities because you are a mom, right? That's your identity. So when we think about the identity of the version of you that experiences intentional nourishment, consistently nourishes your body with intention, on purpose, in a way that is best for your body, right? We get to like, for each one of those bullet points, I always encourage people like sit with and come up with what is the thought, right? Because we think about the hypothalamus. What does the version of you, or if you can't see yourself in that version yet, but what does a person who has the same exact life as you, the same exact demands, the same exact responsibilities, and shows up very intentional with how she nourishes her body? What does she think about this exact challenge? And it's a really weird way to think about it, but if you pose a question to your brain will always find an answer. So if you just sit with each of those bullet points and you think about, I'm going to come up with what is the thought that a version of myself or somebody else who has the same thing, but still manages to accomplish intentional nourishment, what does she think about this challenge? You will start to peel away at some new creative thoughts that will open up things. For example, I've had someone say like, I hate cooking meals. And I've had them come up with, I so appreciate this meal planning service that I get to use. Like her thought is like, okay, well, I don't have to be the one to cook it, but it's like so valuable that I prioritize investing in meal service, right? That's an example. Or if something else is like, I don't have time. Well, the person who does the intentional nourishment version of her thinks like, this is actually what buys me time because now my brain is going to be more focused. I'm going to be more patient and calm, and it actually amplifies every single minute of my day. Like they just think about those thoughts in a different way. Does that make sense?
Mm-hmm.
So it kind of takes
Yeah.
a little bit of like sitting with it, but I invite you to that, like just for your own exploration. Jot down all the bullets of challenging, what's hard about it. And then on the right hand column, put like, well, what does a version of me who has the same circumstances but accomplishes the intentional nourishment anyway, what does she think about these exact same challenges? Because that's where you'll come up with the creative solutions.
Okay.
How does that sit with you?
Yeah. I will try that.
Yeah, cool. It'll be fun. It'll be fun to see what comes up. Cool. Let's see here. Joanne said, I'm sorry that I have to leave to get to my next appointment. Saw that some of the diagrams that show me some interactions where I already have issues. Thank you. Looking forward to the replay to go through it again. Good, good. Robin says, I get it. Yes. Awesome. So good, ladies, to be here and to get to spend time together and to see you. I don't know who iPhone is. Do you have any questions or anything that we can help support you with before we wrap up here? Oh, she's able to unmute. Or Robin, do you have anything else that's coming up for you? It doesn't look like it. All right, Nicole, Megan, anything else that you want to add, or should we can wrap it up if everyone's complete?
I think we're good. I feel like we covered a lot today, and I loved the dialogue, and I feel like, again, one simple step, one intention, that's a great takeaway, if nothing else, for everyone. And so just working on continuing to put that into practice is a great first step.
Yes, yes. And like I said, we will be sure to share the recording and those free gifts for from each of us with the recording when we send out the replay tomorrow. And of course, any of us are available. If anyone's like, I want to take this further, I want to have some more support or just get some more questions answered, please feel free to reach out to Megan, Nicole, or myself. We are absolutely eager and happy to help provide service and support for you in any way we can. It's been great to connect with you. Have a wonderful rest of your day. Thank you.
Thank you.
Thank you, everyone.
Thank you.